Hey everybody, welcome to Hurst Review. My name is Annette. I'm one of the instructors here at Hurst Review. So whatever you're doing on this Tuesday evening, I hope it's been a great day. Whether you are just now getting up and getting ready to go to work or you've had a busy day, I'm just thankful that you've taken time out of your day to join us here at Hurst Review. In this session, do you see what we're going to talk about? You got it. We're going to talk about insulin and diabetes. So let's just jump right into it, okay? Let's talk about insulin. Have you ever wondered how they determine what is going to be that initial dose of insulin for the client? How did they determine that? Well, if you didn't know, initially it's going to be based on their body weight. That's exactly right. Initially, that dose of insulin is going to be based on their body weight. And the average adult dose of insulin, you see it right here on the screen, is anywhere from 0.4 to 1 units per kilogram per day. So that is where they're going to start. They will start with that dose of insulin. And then you know what they're going to do. That's right. They are going to adjust that dose of insulin based on their blood sugar, and they're also going to check the urine. We're going to look at the urine to see if they are spilling over any glucose or ketones. So that's where they're going to start with that dose of insulin. Initially, it's based on the body weight. I know a lot of times students are like, it's based on their blood sugar. And I'm like, well, initially when we're starting out, we're going to start off with their body weight. 0.4 to 1 units per kilogram per day. Now, let's move on a little bit further and let's talk about insulins, because I know in nursing school you learned about all of the different types of insulins. You learned about the onset, the peak, and the duration of insulins. So do you remember what they are? Well, if you don't worry, we've got you covered. So let's talk about this for just a minute. So let's talk about all of the different types of insulins, and let's talk about our onset, peak, and duration. Now, the way that we're going to do this is we're going to show you one of our animations. From time to time, we show these little brief visuals for you. So hopefully it's an easy way for you to understand what is that onset, peak, and duration. So here's just a little bit of a review, and then I'll be right back.
Let's talk about insulin. First, look at this curve. This curve represents rapid-acting insulin. You know, like your Aspart or Novolog. It has the most rapid onset at 15 minutes, peaks at 1 to 3 hours, and it stays in the body for a duration of 3 to 5 hours. This rapid onset is why we never give rapid-acting insulin without food right there at the bedside. Now look at the next curve. This is regular insulin. Regular insulin is also known as short-acting insulin. It has an onset of 30 minutes. It peaks in 2 to 4 hours, and its duration is 6 to 8 hours. Remember, regular insulin is the standard we can give IV. All right, this third curve is NPH insulin. Now, NPH insulin's onset is 1.5 hours. Peak is 4 to 12 hours. And the duration is 16 to 24 hours. Is NPH insulin cloudy or clear? That's right, it's cloudy because it has all those little particles suspended in it to make it time-released. Now, the last type of insulin is long-acting insulin, and the most common long-acting insulin is glargine or Lantus. This fourth curve is glargine. Look at this curve. What do you notice that is different about the glargine curve? That's right, it has no peak. That's a good thing because the long-term vessel damage seen with diabetes is from all those fluctuations in blood sugar. That's why glargine or Lantus is such a popular insulin. It provides steady control for a long time. The onset of Lantus is 2 to 4 hours, and the duration is 24 hours.
Okay, I hope you enjoyed that animation. I will say one of the things that we do here at Hurst Review when we're working with our students is we try to engage you in this learning. So we know some of you are auditory learners, so just sitting back and listening to us is all you need. Some of you are visual learners. You love to see things. That's why we have pictures. That's why we have animations. And some of you are kinetic learners. You've got to get your hands on it. So that's where our workbook comes into play. But let's just keep on going as we're talking about this topic of insulin and our diabetics. So let's review insulins just a little bit more and remind ourselves of a few things. Now, do you see this graph here? Let's talk about it. When we're talking about regular insulin, you remember that one's clear, don't you? Absolutely, yes. And you know that you can mix it and you can give it IV. Now your NPH, that's your intermediate acting insulin, it's cloudy. Can't we mix our regular and NPH together? Yes, we draw it clear before cloudy, don't we? So we can mix this one, and did you know that you could give it IV? You can. Now we also have Lantus, that's our long-acting insulin, like Lantus or Glargine. It's clear. But let me tell you something. Don't let it fool you because it's clear, because remember, you cannot mix this with any other insulins, and you cannot give it IV, okay? So that's a great review to help you remember those different insulins, what you can mix, what you can give IV. Now I've got a question for you. Let's look at this together. What is the standard insulin that is used for IV? Like when you have a client that comes in and they need some insulin and the healthcare provider says, let's go ahead and give this IV. What is the standard one that we give IV? You got it. It is our regular acting insulin. So regular is the standard one that we give IV. I will say, and you know this, you can give rapid acting insulin if it is prescribed, but you better know which one you're giving because your doses are going to be different, aren't they? Yes. So we've got to make sure we understand which one we're giving. The standard one that we give IV is going to be regular. Okay, I've got another question. Are you ready for this one? How do they choose the right insulin? Have you ever thought about that? Have you ever wondered how when the healthcare provider is trying to determine like what exact type of insulin this client should be prescribed? Well, they're going to look at a couple of different things. Here we go. They're going to look at their lifestyle, they're going to look at their diet, and they're also going to take into consideration their activity level. They have to take all of those into consideration when they're formulating this plan for their clients. So our goal, do you see what our goal here is on the screen? You're probably looking at those numbers and saying, those aren't normal. Well, they're near normal because our goal with our diabetics is try to get that blood sugar near normal, which is 80 to 130. When you sit back and think about this, I think we would all agree if we can get our diabetics in this near normal range, we're doing really well, aren't we? Yes, so that's a good thing. Now, diabetes is a chronic condition, so we have to do a lot of education with our clients. So let's talk about a couple of things that we are going to educate our clients about and we're going to talk to them about. So let's talk about client education for just a moment. One of the things with my client education that I want to focus on is the fact that they can have drawn a hemoglobin A1C. So let's talk about what a hemoglobin A1C is. You know what that is, don't you? Yeah, we know that this gives an average of what the client's blood sugar has been over the past 3 to 4 months. Over the past 3 to 4 months. They will draw it, you'll see on the screen, it's going to say every 3 to 6 months because that's how often the healthcare provider may choose to prescribe this or check those hemoglobin A1C levels. But it tells us what their blood sugar has been over the past 3 to 4 months. You and I both know that this is a great way to see how well our diabetic is doing with their treatment plan, how successful things are. It also tells us if our client's being non-compliant with this too. So a hemoglobin A1C is a great way for us to evaluate our treatment plan for our clients. Now, I've got an NCLEX tip for you. We know that students love NCLEX tips. So here is one of our NCLEX tips when it comes to your diabetics. Do you see this on your screen? When you think about a diabetic and they get sick, they have some type of illness, they have some type of stressor, This is what I want you to be worried about. DKA. I think we would all agree DKA is life-threatening. Yes. So anytime I have a diabetic and they get sick or they get stressed, we're going to educate them, aren't we? Yes. We're going to tell them, hey, you really need to be checking your blood sugar more frequently, because as a natural response to that illness or that stressor, their blood sugar is going to go up. When you have a normal, healthy pancreas, it can handle those fluctuations. But I have a diabetic who does not have a normal, healthy pancreas, so during the times of an illness or a stressor, I know that their blood sugar can go up. That puts them at risk for DKA. I'm going to talk to my diabetic about checking their blood sugar more frequently, and their provider is probably going to provide a sliding scale for them during that illness or that stressor. So we're going to talk to our diabetics about that. We're going to educate them about that. Another thing that we're going to educate our diabetics about is rotating injection sites. So I want them to rotate within an area first. So let me talk about that. Because from my experience, when I walk into a diabetic's room to administer their insulin, I either ask the client or I look at their MAR and say, okay, where did you get your last injection of insulin? You got it in your right arm? Okay, well, let me give it to you in your left arm. That is what we as nurses consider rotating sites. But I want you to step back and think about how we are educating this diabetic to give themselves injections. We know that you're not supposed to use one site over and over and over again, because that tissue can do what? That's right, it can get hard. Are they going to have good absorption of their insulin if that tissue becomes hard? No. Don't we want good absorption of their insulin? Yes. So I'm going to teach them all of their sites that they can inject insulin. So let's just say I'm going to teach them to go in their abdomen. So I would tell them, okay, on the right side of your abdomen, let's use like a clock face. And I want you to rotate within that area first. Once you've used up your sites within that area, then we're going to move to another area. But you know what I tell my diabetics when I'm talking to them about this? Be careful, because once they move from one site to maybe another, there's the potential that they could have increased absorption of their insulin in that area, which is going to do what to their blood sugar? That's right, drop their blood sugar. So I have to warn them about that, and let's teach them to rotate within an area first. Okay, how are we doing? You have any questions, just pop them in the chat box and let me know. That's why I'm here. But let's move on. Let's talk about some other education that I'm going to talk to my diabetics about, and that is the possibility of an infusion pump. You know, the little portable infusion pumps that clients have. Do you know what type of insulin is used in those infusion pumps? Do you remember? It is rapid-acting insulin. So good job if you thought about rapid-acting insulin, because that is the type of insulin that is used in those portable infusion pumps. What happens is the client is receiving like a steady basal level of insulin, just like a normal healthy pancreas, and then the pump is going to administer additional boluses with meals or if they have an elevated blood sugar. But this is a great way for us to get our diabetics' blood sugar in a better control, which is really what we want. We're trying to get a tight control of their blood sugar. We're trying to eliminate those sharp rise and fall in their blood glucose, because that's what causes all of the damage, and we don't want to cause any long-term damage for our diabetics. So, how was that? Was that a great review to remind yourself about your insulins and the different types of insulins when we're talking to our diabetics? And a few great little education points that we're going to make sure that we cover with our diabetics. So, it's time for us to do a question. So, we're going to talk to you about select all that apply type questions. So, I know from my personal experience, to tell you the truth, these kind of scare me a little bit. I don't know about you, if when you see any type of alternate format item, you kind of freak out a little bit. So we tell students when we're working with them, we're like, okay, look, we know you're not going to like them, but let's try to make these your friend, because we know that NCLEX may ask you questions in a lot of different ways. So we just want to approach this question knowing the information that we do know and answering it safely. So let's look at a few guidelines that we have. Select all that apply will be bolded. I can't tell you how many times I've reviewed tests with students and they're like, what? I did not even see that it said that. That's why I only picked one answer. So please make sure you're paying attention to this because it will be in bold letters. Select all that apply. You could have up to 10 answer options. Is that going to freak you out? Maybe a little bit, but I really don't want it to, okay? So I would say if I got 10 options, I'm going to be, ooh, that's a lot. I better buckle down and focus and get more right than wrong. Is that what you're thinking? You're like, I want them all right. Okay, good for you. Choose all of the right options. Choose all of the right options. So when you're looking at them, if it's a statement that's asking for something true, you're going to pick those true statements and then look at each as a true false. I will say when you're looking at each option stands independently of itself. So it's not like you're going to say, okay, if I do this one, then I'm also going to do this one. You have to look at each option independent of each other, not building on top of another. So are you ready for a select all that apply type question? Sure you are. Since I talked about it, I'm going to step away for just a minute. The question's going to come up on the screen, so I'm going to give you a minute or two to come up with your answer, and then I'll be back and we'll go over the right and the wrong answers and why. So good luck. Okay, I personally love questions like this. I guess it's because I'm an educator at heart, because it says a client with diabetes mellitus has a newly prescribed insulin pump. Which statements made by the client indicates understanding? So we are evaluating our teaching, are we not? So when I look at questions like this, if we are trying to determine, does the client understand our teaching? I like to say I'm sitting at the bedside, and if the client were to make a statement, I would look at them and say, good job, you got that right. You have a great understanding of that concept. And if they were to, and I would pick that answer, right? And if they were to make a statement that makes me say, you know what? I need to go back and I need to clarify some information with them because they really don't clearly understand that, then I would not pick it. So when I'm looking at statements that indicate understanding, I'm looking for true statements that the client were to make back to me. So when I look at option number one, I'm sitting at the client's bed, we've just finished teaching, and I'm evaluating my teaching, and I look at the client and say, okay, let's talk about some options that you have for wearing your pump. And if the client were to look at me and say, okay, Annette, I can wear my pump on the waistband or pocket of my pants. In my mind, I would say, that is true. Those are appropriate areas that the client may place their insulin pump. So option number one is true. I need to pick that one. Now option number two, if the client were to look at me and say, hey Annette, I can eat whatever I want as long as I cover the calories with sufficient insulin. Now, I know we know some diabetics like that, right? But is that an accurate statement? No, we don't want this client just eating whatever they want and just bolusing themselves with insulin, do we? No, that is not the proper way for them to manage their diabetes. So option number 2 is false. Now, when I look at option number 3, if the client says, all right, let me talk about some times where I can take my insulin pump off. I know that when I go exercise, that's an appropriate time, that's okay. I would look at the client and say, you're exactly right. If you didn't remember, there are times that the client may remove their infusion pump, like when they exercise, when they shower, when they engage in sexual activity. So there are some times that are appropriate that the client may remove their infusion pump, and exercise is true. That is one of the times. So I am going to pick option number 3. Now, when the client says option number 4, I need to check my blood glucose several times a day. Yes, I'm going to be like, great job. You have a great understanding. Yes, we need to make sure that your blood sugars are staying in that normal range that we need to. So option number 4 is a true statement. That one probably was a pretty easy one, so we need to pick it. Now, when I look at option number 5, if the client says, okay, I understand I have this little catheter here, and I need to make sure that I change it every week. What did you think about that statement? Did it kind of make you sit back and go, well, they do need to change the catheter at the end of the pump. That's true. But every week, did that seem just a little bit too long to you? It is, okay? 1 week is way too long. I know that my diabetics are at an increased risk for infection because they do have an immune system that's not working properly. So I need to make sure that they change that more frequently, like every 3 to 5 days. A week is just too long. So for future reference, when you get a question like this, if part of the answer is right, but part of the answer is wrong, don't pick it. So option number 5 is false. How did you do? I know it's a select all that apply. It's not your favorite type of question, but thank goodness for partial scoring, right? So as long as you're getting more options right than you do wrong, you're getting partial credit. And I know you want to get them all right. But when we're practicing, we're getting ready for the NCLEX exam, I'm happy if you're consistently getting more right than you are wrong. Guys, we have one more question that we would love to do with you in this session. So it's just a good old-fashioned multiple choice question. But good luck with this, and I'll be back and we will talk about it. Another education question right up my alley, which I love. It says we're educating the client about subcutaneous aspart. Do you remember what type of insulin that is? I hope so. That's our rapid-acting insulin, right? So which client statement indicates that teaching has been unsuccessful? Do you see the difference? In the previous question, we were saying teaching was effective, so I needed to look for true statements. But if the client is is saying statements that are negative or they're wrong, that indicates that teaching has been unsuccessful. So we've got to pay attention to those keywords because here I'm looking for a false statement. So let's look at option number 1. If the client says, I can give myself insulin in my abdomen. You know that's right, don't you? Yes, that's a great place for our diabetics to administer their insulin by themselves. They're going to need to learn areas that are appropriate for them to administer insulin, and the abdomen is surely one of those. So option number 1 is true. Now, when I look at option number 2, it says, I need to eat within 30 minutes of taking my shot. Is that true? This is where you have to understand your onset, your peak, and your duration of your insulins. What is the onset of aspart? 15 minutes. There you go. So 30 minutes is too long. I don't want this client waiting 30 minutes because you know what could happen? You know too, that blood sugar could bottom out. So this indicates that my teaching needs reinforcing. I need to clarify the information. Option number 2 is false. Now, because we have found the correct answer, we still need to look at the other options just in case, because I know sometimes you've been known to change your answer, although I wouldn't recommend it. Let's look at option number 3. If the client says, hey, I need to check my blood sugar at least 4 times a day, does that sound appropriate? Yes. I want the client to be able to check their blood sugar before meals and at bedtime. That's great. I like that. Option number 5, if the client says, I may need to drink a half a cup of orange juice if my sugar gets low, like less than 70, isn't that a great source of our client to get their blood sugar up? Did you remember when clients' blood sugar drops, how they need to eat or drink a simple carb? Yes. So I want them to eat or drink a simple carb, something that's going to get their blood sugar up, and then I'm going to follow it up with a complex carb and a protein to get it to stay up. So option number 4, that's a true statement. So that is not anything that needs follow-up. It does not indicate unsuccessful treatment. So how did you do? Option number 2 is our correct response. I've got some good news for you. We have a lot of different options that you can choose from to take our review. So let me talk about that. I would love for you to go to our website, which is pretty easy. It is www.hurstreview.com. Check us out there and look at all of the ways that you can take our class. I will say we have a lot of different options for you, and whichever option you choose, you still get the comprehensive plan, meaning you're still going to get a workbook, you're going to get a student account online with access to questions in our question bank, a lot of practice questions, and we have a resource library. We have videos that are pre-recorded that you can watch. We have 4 readiness exams. We have a resource library with documents in there, and these are the ways that you can take us. So whichever way you choose to take us, you still get everything. It's just delivered a little bit differently. Now, in-stream is like what we're doing right now. You would log in for 3 consecutive days, and our schedule typically runs like a Monday, Tuesday, Wednesday, or a Wednesday, Thursday, Friday. I would say make sure that you give us time to mail the workbook to you if you're going to start an in-stream class. Like today's Tuesday, I wouldn't go online tonight and sign up for a class that starts tomorrow because you're going to want to have your workbook, and that takes us about 3 to 5 business days to mail to you. So if you like this type of event, if you like chatting in the chat box with your other classmates or your instructor, and you like having someone live standing in front of you, you would love what's called our in-stream. Now, the Hurst Now that you see on the screen, let me talk about that. That is for the student, in my opinion, who doesn't really have time to commit to 3 days, either in a live classroom or a streaming session. So you need to do it with some flexibility on your own time frame. Well, Hurst Now may be something that you would consider. So we would mail the workbook to you, but we're not just going to mail it to you and say, here you go, good luck, here's your study notes, get in your account. No, we're going to guide you through this process. You will watch pre-recorded videos as you're filling out your workbook. You'll have your questions in your question bank. You'll have your resource documents. You will have your readiness exams. You will have everything that you need. It's just kind of at your own time frame and your pace. There is closed captioning on these videos, which is really nice. We have a checklist, which we provide a checklist for all of our students. We call it our checklist for success because I love a checklist. And or maybe your friend was your checklist in nursing school. So we have a checklist that guides you through whichever way you choose to take our review. I also want to mention another product that we have, and it's called Hurst Elevate. So who is Elevate for? Well, look at the screen. If you need a little boost with your confidence when it comes to preparing for the NCLEX exam and you really need some help with decreasing your anxiety, Elevate is something that you would be interested in. Now, Elevate, you can see it's structured, it has guided assignments, it's not busy work, but you have to take the traditional course first before you can proceed and start Elevate. So some of our students will take our traditional course and then decide, you know what? I want to add Elevate on. That's great. Some of you up front may know, okay, I need the whole course, I need Elevate, I need everything because I want to pass the first time and move on with my life. Or if you are a repeat test taker, this is my opinion, I think Elevate is great for repeat test takers or anybody who always struggled just a little bit more than the traditional student just to pass. That would have been me, right? So Elevate is just going to put you in that structured plan, and it's going to do what the screen says. It's going to increase your confidence, decrease your anxiety. Now, some of you may be thinking, how am I going to pay for this, Annette? I just finished nursing school. I don't have any money. Well, guess what? Aunt Marlene thought of it all when she came up with a payment plan. How many of you need a payment plan from time to time in your life? Most everybody, right? So if you'll check our website out, it gives all of the specific details of the payment plan that we have available. So go to our website, hurstreview.com, check us out. Ask us questions. We would love to help to guide you in this process and help you in this journey, pick out which course you think is best for you. Just remember, everybody still gets all the same things. It's just delivered in a little bit different format. Everybody gets an online account. You're going to have a workbook. You're going to have questions. You're going to have readiness exams. You're going to have everything that you need. We're going to give you testing strategies. We are going to work with you until you feel confident as you can be, saying, I am ready to go past that NCLEX exam, prove to them that I'm a safe nurse, get that dream job, move on with my life, and go to the next chapter. We would love to be a part of that journey. Here at Hurst Review, we're like family. So family encourages, supports, motivates, wants the best for their family, and that's what we want for you. We know you've worked hard. We know you deserve this. You have sacrificed a lot to be where you are right now in this journey. Let's partner together. Let's pass the NCLEX the first time and move on with our life. If you have any questions, I'll be around for a minute or two. Otherwise, I hope you guys have a wonderful evening, and thanks again from Hurst Review for taking time out of your day to join us. See you later.